During the cold and flu seasons, people tend to cough, sneeze, and can cause a lot of issues through their mid-back, resulting in maybe a rib being out of position or a strain of the intercostal muscles, which when you take a deep breath in, it would give you some pain in that scenario, and that would be where we would need to get you in and help get everything back in the right alignment, get those joints moving again to help alleviate some of that inflammation and swelling caused from that cough or a sneeze and things not lining up the way that they should be. There's a lot of techniques that you could use to help get those ribs back in the right position or treat the mid-back. Typically it's going to be hands-on at our office. We like to adjust patients where you're going to hear and feel a little bit of a pop as we're doing that. There's other techniques for elderly patients, maybe if they're a little more brittle or frail. We do have activators that does the adjustment for us to make it a little bit more gentle on those patients. There's a variety of techniques that we can use to adjust that mid-back and your ribs to help get everything back in the right alignment. And then we would of course want to use maybe some muscle stim, massage, traction, ultrasound, just depending on what the case is for the individual, and we're going to do what's right for them to help get them as healthy as we can as quickly as possible. At Heartland Chiropractic, we have such a variety and an array of techniques and therapies. Whatever the patient needs, we have that at our fingertips to help get the patient better. Depending on the severity of the injury through that mid-back, we might suggest various exercises at home, maybe some stretching. We would give those to the patient so that they can help facilitate their own healing in between visits while coming in to see us. Depending on the severity of the injury, some injuries might take a little bit longer, some might take a little bit less to get better. Over the course of that care, we're going to help determine how bad this was. We're typically going to start with seeing a patient closer together in the beginning. We want to get them out of pain as quickly as possible, and then yes, once they are out of pain, we still need to see you and follow up down the road just to help make sure that everything is stabilized and staying where it needs to be. So typically we start with visits a little closer together, spread them out as you feel better, and eventually we don't need to see it as often, but then it is important to help do some routine maintenance throughout the year just to help offset the wear and tear you're putting on yourself day in and day out. As far as trying to figure out how long it's going to take for a patient, there's no cookie cutter type of a treatment plan. Each patient is individually unique, and so we're going to treat them and help get them better on a case-by-case type of a basis.